I am with the in the Department of Medicine. This is where our program is housed. But again, we fall under the umbrella of the Integrative Medicine Collaborative that Aaron has introduced for all of you. So actually, before we start, I think it would be good to make sure that we're all, feeling good, and I'll introduce an pressure point that you can stimulate to help with any problems you might be having involving the head and neck region. For example, headaches, neck pain, any of you currently with upper respiratory symptoms, hopefully nothing acute, but allergies and whatnot. This point called feng shi, or gallbladder 20, actually translates in Chinese to the wind pool, is going to be in the back of the head, kind of where the occiput meets the neck. And what you can do is just, hopefully you guys are all seeing me right now, but put your hands like so, and then kind of let the thumbs drop into that little depression, again, where the head meets the neck, and that's gallbladder 20. So this is an acupuncture point that you can stimulate, with your fingers. We don't have to put a needle in there. Again, I'll talk a little bit more about this later on, but you can apply steady pressure. You can massage in a circular or up and down motion, and that would be a way of stimulating this particular acupuncture point. We call it acupressure. Okay. So hopefully all of you have had a chance to do that for yourself. Okay. So, I wanted to introduce myself and just give you some context, as I, share, our approach here. But, I'm a lifer here at UCLA. I actually was born at UCLA, and did undergrad here, and went to medical school, did residency, and then I did fellowship training in geriatric medicine. So I'm boarded in geriatrics as well. But during my time training as a geriatrician, I also did a limited fellowship in integrative East-West medicine. This is our brand of integrative medicine that my father, Dr. Kit Hui, developed over 25 years ago. This is where I come from. Since 2006, after completion of my training in geriatrics, I've been with the Department of Medicine. I was part of the initial crew migrating the department's tentacles into the west side here in Santa Monica, kind of established the primary care track residency program. But I also obviously maintain my ties with East-West medicine. And since 2013, I am with East-West medicine full-time, leading efforts to initiate and expand our, East-West medicine flavored, patient-centered medical home. Just to tell you a bit about myself, we do have a little dog. My wife is also a physician. She's critical care, intensive, critical care medicine, pulmonary sleep over at Kaiser West LA. There's our two daughters, and picture is us in front of a landmark in Florence, Italy, when you could still travel internationally. I know the Lakers recently won the NBA championship, and I know UCLA Health is an official sponsor and big supporter. But I've been a Clippers fan for the last 20 odd years. So another disappointment for us this year, but there's always next. Anyway, just to introduce integrative medicine for those of you who are not familiar with this whole area. I wanted to start with some definitions. These are refer to non-mainstream approaches and practices that have been developed outside conventional or Western medicine. When these approaches are done in place of conventional medicine, we term it alternative. When it's done together with conventional medicine, it's complementary. I think in the last 10, 15 years, there's been a move to use the preferred term integrative medicine. Most patients do not use alternative medicine in place of conventional medicine. They usually use it alongside. So, the best way to do it is to do integrative medicine or integrative medicine in health, where we will combine both conventional and complementary and alternative or so-called CAM approaches, for which there is safety, for which there's evidence of safety and effectiveness. So, integrative medicine is, more than just a collection of treatment modalities. It is about wellness. This is a wellness webinar that we are engaging in right now. But the academic consortium for integrative medicine and health, which is a group of over 70 programs within the academic medical community, of which UCLA is one partner, adopted the definition you see here for integrative medicine and health, and again reminds us that there's an important relationship between the practitioner and the patient, and that we should try to focus on the whole person, and we should do this by making use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. So, this is a field that's still in its infancy, although, again, I think a lot has changed in the last 10, 15 years. Anytime you have a growing field, eventually, there's a licensing authority, there's training programs so that people can get credentialed and be so-called experts. I'm happy to report that, UCLA, at least in our program, East-West Medicine, we have one of the fellowships from which physicians can become boarded in integrative medicine. But again, this is good medicine, and it's where we really want to shift the focus from disease to health and healing. With the aging of the population, with our disease-based model, and the problem with too many drugs in place, I think integrative medicines and health's emphasis on safety, is important. Obviously, as I will talk about going forward, specifically for pain, how using many of the low tech, high touch, less expensive interventions is going to be helpful. But some of the settings that integrative medicine and health has become quite supportive and prominent and accepted are going to be in the settings I've listed on the right-hand side of the slide. So again, we're talking about specifically about pain, but the military and the Veterans Administration has really done quite a bit of work in delivering this to our military personnel and veterans. But integrative medicine and health also has a strong footing in cancer, helping both patients with cancer, but also cancer survivors. And then finally, I think it's in everyone's interest for population health, especially given cost concerns and whatnot, that we want to try to help people stay healthy, stay out of the hospital. And I think this is where the integrative medicine and health approach, must be at the forefront. So, just to give you a sense as to what, kind of thing we have here at the Center for East-West Medicine, we're an example of an academic integrative medicine program. We have a very robust clinical program, as you can see. We also do education for medical students, for postgraduate medical trainees, certainly for the public, as I am, doing this webinar at this time. But, we again have developed a brand of integrative, or a flavor of integrative medicine here at UCLA within the Department of Medicine, blending traditional Chinese medicine and other integrative health approaches to problem solve and enhance patient care. So it's interesting, I'm giving a talk today about how this can be used for pain, but I want to reiterate that our clinical program is not just for pain. We are not a pain clinic. Many patients equate acupuncture with pain control. Certainly can be very useful, and I will talk about that, but it's much more than that. And the whole integrative health approach is for optimal wellness. It's not just to treat specific painful conditions. So what is East-West medicine, or what is our flavor of integrative medicine? Well, I think the hallmarks are outlined here. It is, as Aaron mentioned, evidence-informed. We are treating whole persons, treating persons with the problems, not specific problems. The East-West approach has a great appreciation for the significant role of soft tissue dysfunction in health and disease, not just for pain. We'll talk about that as well, and really emphasize disease prevention and health promotion. When we talk about prevention and health promotion, is not just getting your vaccinations or doing your cancer screenings, but it really is about wellness. Again, go back to why we're all here today on Wellness Wednesday, right? To try to think about how we can take care of ourselves better and our loved ones better. But the integrative East-West medical approach, again, also done through the lens of traditional Chinese medical philosophy. That's the kind of approach to healing that we here at East-West Medicine are most familiar with. So, some of the things that, we might do in our clinical program, how we may share thoughts with our patients is, certainly to use some modalities and strategies. While we recognize the dominance and importance of drug therapy, in Chinese medicine, it would be herbs. So I think even though it's natural products, people have to be reminded that that's drug therapy also. We don't do too much Chinese herbal medicine here in our program, but we will use some of the other things like acupuncture and its variants, body work type techniques. But as it again relates to self-management and self-care, I think there is a whole body of knowledge within Chinese medicine looking at the importance of lifestyle and body-mind exercise. So self-care approaches in terms of keeping us healthy and solving problems that we deal with on a day in and day out basis. So, again, don't want to keep emphasizing this. For those of you who may know Chinese or speak Chinese, yang sheng is, two characters. Yang literally means to nurture, to raise, to take care of. Sheng literally means birth, life, vitality. So yang sheng is this concept of health preservation or life cultivation. And this kind of venture needs to be 365 days out of the year, 24/7 effort that we want to pursue to live in harmony with our environment. And I think for most people it would make sense that we want to adjust the diet, right? Eat the right way. We want to exercise the body. But Chinese medicine, Chinese culture would also talk about how we need to regulate the mood. You don't want to get too angry. You don't want to get too happy. Everything in moderation, everything in balance. There's comments on how much sexual activity we as individuals at different time points may want to engage in, and then even adapting to the climate. So things that might be appropriate for cooler weather may not be so appropriate when it's warmer out, or people living in different regions with different climates may have to do things differently to try to live in harmony with their environments. So I think this underscores much of how Chinese culture, Chinese thoughts on health would color some of the recommendations and input. So again, in our approach, we utilize Chinese medicine philosophy to add an additional perspective on the patient's health, and we would focus on many of the non-drug, non-pharmacological ways again, clinical problem solving, keeping people healthy, but also doing it in having a foot in conventional biomedicine as well, and doing it as part of a coordinated team. So again, I'm going to go ahead and talk about some of these things in the next 30 minutes, 20 to 30 minutes, specifically as it relates to pain. So hopefully, those of you who are listening are not hurting right now, although I would imagine that some of you are, because unfortunately this is a very common and prevalent problem. Acute pain is necessary for us to stay alive, because pain basically is a warning signal. Lets us know that there's something wrong, that our bodies are being harmed. But when that pain becomes persistent, then you get big trouble, big problem. So what are some of the common pain syndromes that we see here in clinic, that what many of you might be dealing with, or your loved ones might be dealing with? So we can see that persistent pain can be conspicuously associated with degenerative musculoskeletal conditions, joint degeneration, but can also be associated with things like diabetes, toxins, autoimmune disorders, cancer. So again, unfortunately, a common problem that we don't want to miss, and certainly many people suffer, and we want to figure out how best we can deal with it. You cannot just treat the pain because there are some of these adverse consequences that will result because of this chronic pain. You would see sleep disturbance, potentially mood disturbance, cognitive impairment, both from the pain itself, but sometimes the medicines that we use to treat pain can lead to sleep disturbance, mood disturbance, and the problems in thinking, cognitive impairment, right? And then ultimately, these things can lead to functional disability, can lead to falls, and cause problems, not just for the patient experiencing the pain, but disrupting the social relationships, work, family, and whatnot. So the totality of one's health can be affected by persistent and chronic pain. So, you could do a whole lecture or whole presentation on some of the medicines that we would commonly use to address pain. So I just want to summarize a little bit of, what is there or what is available, what many of you, might be using. Think about, what are some of the salient features, and particularly with a focus on adverse effects. So, acetaminophen or Tylenol is the tried and true and probably the safest. Most patients, I think, can do Tylenol without too much trouble. Certainly if you have liver condition or on a lot of medicines that affect the liver, you want to be careful with too much Tylenol. Some of the other over-the-counter medications that are available, or the so-called non-steroidal anti-inflammatory drugs, NSAIDs, some common ones I've listed there on the screen. We need to be careful, especially with long-term regular use. Okay, so you be mindful of toxicities on the heart, cardiovascular system, and also on the gastrointestinal symptoms, so bleeding ulcers and stomach upset. And then, this whole area of opioids certainly is, actually, I'm sorry, let me just, I want to make sure that there's no, right now the screen is actually taking up my entire, the slide is taking up my entire screen, so I cannot see if there's any questions in the chat section or whatnot. But if anybody wants me to stop, you can go ahead and stop me. I think for sure we'll have some time at the end to answer any questions. But if anybody really has a pressing question, go ahead and just interrupt me, okay? But yeah, I wanted to comment on opioids. For those who are physicians would know that, depending on how long you've been in practice, would know that this pendulum has swung several times. When I wasn't going to medical school, I think there was a thought that we weren't using opioids enough. And then as I kind of get through residency fellowship, then it was that, oh, maybe we're using these too much. And certainly now with the opioid epidemic, we would know that we need to be careful with these types of medicines because they're causing a lot of trouble, again, not just for patients, but for families as well. So with opioids, again, highlight, the potential for dependence. This concept of tolerance and abnormal sensitivity is what leads to the requirement for higher and higher doses. So even though you start out with a small prescription, after your dental extraction or after your minor, musculoskeletal surgery, or C-section, sometimes it's almost like you just have to keep adding. You have to keep taking more. And some patients may not realize that opioids can have adverse effects on your immune function and also on the endocrine system, hormonal system. So many men who take a lot opioids would get problems with low testosterone and all of the issues that go along with that. There are some other medicines that some of you may be familiar with and may be taking too. These are so-called adjuvant medicines. These are not traditional painkillers, but medicines that we use alongside the medicines in the previous slide to support and to help. So you say adjuvants more useful in chronic and neuropathic or nerve type pains. We will use anti-seizure medicines like gabapentin or Neurontin, pregabalin or Lyrica. We sometimes will use antidepressants, both old school antidepressants, but also newer ones that may have more effect or target on some of the pathways that contribute to pain or chronic pain. Transdermal lidocaine is something that you can get over the counter. This essentially is a topical anesthetic. Can be very useful. So again, Erin used the word a non-pharmacological, non-drug at the as part of her intro to what the Integrative Medicine Collaborative is trying to do. So yeah, I think there's definitely been an emphasis on drug therapy. It's just part and parcel of the conventional biomedical, reductionistic approach. And unfortunately also specifically for pain over the years. So I think, we would do well to, take stock on drugs. I mean, that as a physician, that's my most powerful tool, that I can write a prescription for something and give to a patient to help them with their problem. But, with that power comes a lot of, risk too. So, just kind of a more public service announcement, again, for those of you who are taking medicines for, various reasons, whether it's acute issues or chronic conditions, just make sure that, you are taking medicines you should be taking, maybe working with your treating providers to see if there are medications you could do without. And then it's always good to know what you're taking your medicines for, right? And do I know why I'm taking a particular medicine? Because that, again, is an important thing that has consequences for your overall health. So, I'm glad that those of us in medicine have taken this to heart, and certainly for a very common problem, a pain condition no less, chronic low back pain. One of the major professional organizations, and the one that I belong to, American College of Physicians, would suggest that non-drug treatment is going to be preferred in first line as opposed to the use of medication. So, many of the strategies and treatments listed here under recommendation 2 for low back pain, I think can be applicable to some of the other pain conditions as well. But, I'm going to go ahead and talk about some of these in the next 10, 15 minutes as well. Another major component of our East-West medical approach is an appreciation for soft tissue dysfunction. Again, not just for pain, but also for non-pain conditions. The soft tissues would refer to things like muscles, tendons, ligaments, and then here in the right-hand corner, you see that wispy white material. That's fascia. That's the connective tissue that's covering the muscles and the tendons and the ligaments. And this is actually a very fascinating area of research. I think one of the unintended consequences of research into acupuncture has been things that we have found out, and found out about the fascia, how important that is to overall health. But soft tissue dysfunction, big issue, and certainly something that we want to address. Typically soft tissue dysfunction can manifest itself in so-called trigger and tender points, all of us are likely to harbor these or have them. We may have them as obvious issues, and we may have them as less obvious issues, and again, can be used to address both pain and non-pain conditions. So, what gives rise to trigger or tender points, or what perpetuates them? Well, I think about think about, obvious injuries, macro trauma. These are things like car accidents. For those of us who are more sporty or more physically active, think about athletic injuries. For our older patient population, think about falls. Effects of trauma can certainly linger for a long time. Macro trauma, these are the obvious things, certainly can give rise to soft tissue dysfunction. Now, there's less obvious things, things that may be happening on an ongoing basis. This is so-called chronic microtrauma. So this is going to be reflected by, exercising improperly or not exercising, non-ergonomic work environment, improperly designed tools or machinery. So those are kind of less obvious things that we sometimes need reminders for. And all of these kind of injuries, both obvious and less obvious, both past and ongoing, might be modulated by some of these more systemic factors that are listed here. Sleep issues, we'll talk about that. Psychological factors, and then, I'm an internist or a medical adult medicine doctor, so I always think about other influences like medications and hormone disorders and mineral deficiencies. So I think most of you are either sitting in front of a computer or looking at your tablet or smartphone, but we need to all recognize the importance of posture and ergonomics, both work and at home, as an influence on how we feel, on it as an influence on soft tissue dysfunction that I just spoke about, trigger points and tender points, especially right now with work from home for COVID, and we're in school from home. So this is a very simple thing that we all need to pay attention to and make changes as appropriate and as necessary to avoid that injury that I just spoke of, that chronic microtrauma, that less obvious trauma that we may be inflicting upon ourselves. So, having the proper sitting instruments, taking frequent breaks, sitting and standing up, so-called sit-stand desks, wobble cushions, using a yoga ball as your chair, making sure that if you're using a laptop, put it up on a stand or hook that laptop up to a monitor so that you're not looking down, because all of this would again contribute to many of the painful conditions that we commonly experience. Other ways that you can combat this, especially when we're sitting in front of the computer for a long period of time, maybe we can do this right now. I will demonstrate one exercise for you right now, and you can do this with me. So I really like the spinal twist type exercise. If you're sitting in a chair, if you kind of face one way, and then if you grab the back of your seat and then squeeze push your hands in towards each other, this is a good spinal twist type exercise. If you do it on the other side, you get the other part of that upper back side body aspect. But many of us may have a so-called head forward posture, and the chin tuck or chin retraction exercise that's demonstrated by a cartoon is a very good thing too, where you try to line up your ears with your shoulders. That's going to be good. And then this so-called YTWL type exercise, again, to help with chest opening. Okay. So addressing the so-called contributing factors, doing muscle exercises, and then thinking about other physical treatments that you could do for yourself, but also involving other providers like physical therapists, occupational therapists, acupuncturists, massage therapists. That's going to be effective to address this soft tissue dysfunction. So acupuncture, I don't know how many of you have experienced it. I would imagine that a significant amount. I mean, over the years that we've done this, the number increases consistently. This is a fairly mainstream approach. I think pretty well accepted now. We think of it as a method of sending a signal to the body by needle or other means to turn on its own self-healing and regulatory mechanism. So, Chinese medicine would, look at it as a way to access abnormal flow of so-called qi in blood. When we don't have that proper flow, that's when we have pain and illness. Again, acupuncture and its variants are going to allow access into the body to affect the necessary change. So there are different ways of stimulating acupuncture points. I showed you acupressure. Certainly classically, we would use the needles, but you can also do injections. So, we do trigger point and tendon sheath injections here in our clinical program. It's a form of acupuncture, essentially, a needle type treatment. But cupping is something that some of you may be familiar with as well. Again, there are different ways of utilizing acupoints to improve health. And how does it do that? Well, it can do it by affecting various physiological measures, can work at the level of the brain to improve sleep, may also, there's evidence that it can decrease inflammation and also work to regulate many of the neurotransmitters involved, not just in pain but also in mood and whatnot. So, acupuncture has been shown to be effective for various painful conditions, neck pain, low back pain, headaches, nausea, vomiting. Again, a very well accepted approach, even in comparison to some of the commonly used medications for nausea, vomiting. So, pregnancy-related nausea, vomiting, chemotherapy-related nausea, vomiting. And I think one thing, we should be mindful of is that acupuncture quite safe too. So much safer than many of the drugs, as I mentioned earlier, that we use. Now, you don't have to necessarily stick a needle. You can stimulate acupoints with your fingers, with other devices. For those who cannot do it themselves, certainly a caregiver can offer and provide as well. But we teach many of our patients here to use various contraptions. Some of the pictures I posted there to work on acupressure and to do self massage. I just highlight this one study that actually was done by a nurse in Michigan, how such a simple, non-invasive, low-tech, low-cost, patient-driven treatment can be so helpful. But they looked at acupressure specifically for painful knee due to arthritis. And they found that acupressure one times per day, 5 days per week for 8 weeks, just 3 minutes to each particular point, could be helpful for painful knees. And another thing that some of you may not be so familiar with is TENS, or transcutaneous electrical nerve stimulation. These are portable devices that will use electrical stimulation to modify pain perception. Um, this can be used for muscle spasm, for pain, and we often recommend it for acupoint stimulation as well. So again, another way of stimulating the acupuncture point without sticking a needle into it. You apply the stimulation to the point, to the acupoint. But these are relatively safe, relatively few contraindications. I have in the blue, you can see some areas where you may have to be a little bit more careful, consult with your physician. But TENS unit you can purchase without a prescription. You can get them at the local drugstores. You can get them off Amazon, anywhere from $20 to $40. Again, something else you can try for self-care, for pain, for wellness, and whatnot. So here's another point that I want all of you to stimulate now. This is a very famous point. It's going to be if you put your thumb and index finger together, and there's a kind of a muscle that pops up, and you just press up against that second bone in the hand. This is large intestine 4 He Gu. This is a very famous point. It's good for problems in the head and neck region. So people with headaches, with facial pain, dental pain, this is a very effective point. Also, you can use this when you're upset at somebody, or if you're a little stressed out. I think another reason why this is a good point to use is you could stimulate it fairly discreetly, right? You have it underneath the table, right? If you're having a meeting, you're bored. But again, this is a very famous point. You don't want to stimulate this if you're in the later part of pregnancy, because it can actually induce labor. But yeah, large intestine 4 is a good, useful acupuncture point to stimulate. Okay, I'm going to try to move through this see if there are any questions. So, I want to talk a little bit about stress and body mind as an important part of the overall approach to pain. Stress cannot be underemphasized, cannot be emphasized enough in its role in leading rise to problems, perpetuating them, and even causing us to age faster. So again, it's important for us to meet the challenge of daily living, but when stress is sustained or overwhelmed or too much, it can get overwhelming, and that can lead to some of the pathways that will ultimately lead to accelerated aging and lead to the development of different diseases. So you can see in the schematic over here, without getting into all the details, but stress can promote metabolic disorders, can lead to immune dysregulation. So, autoimmune disorders and cancer, and, certainly can affect brain health, okay, with neurodegenerative problems, mood disorders, dementia and whatnot. So, this is why a focus on the body and the mind is the links therein is so important, and why the Integrative Medicine Collaborative is such a proponent of many of the body-mind approaches that would harness the body's own ability to affect that brain function, to affect physiology at large, to make us hurt less, to make us sleep better, to and then doing so ultimately lead to other changes so that our chronic conditions do not get worse. But I would turn people's attention to, even here at UCLA, we have our own app, smartphone app for meditation and mindfulness. There are some other things that we maybe think less of or don't think as much of, but a reminder that journaling can be very effective as well. And then this especially for many of our patients with cancer, support groups are going to be important, and also people living with chronic pain. Obviously, working on catastrophic thinking and how to strategize to deal with disabilities. Cognitive behavioral therapy can be important in chronic pain as well. One of the things that we might do here at East West Medicine is recommend Qigong. This is a Chinese style body-mind exercise. And the poses that are seen there are part of the 8 brocades set, which is a one form of Qigong or one type of Qigong. But we know that Qigong can potentially help people with persistent pain as well. A more famous or more well-researched form of Qigong is Tai Chi. Tai Chi a little bit more complicated because you're moving around a little bit more. But this is also been well studied and well validated as an approach to help with various issues, including chronic painful conditions, but also fall prevention, even heart disease and chronic obstructive pulmonary disease. Some of the our own psychoneuroimmunology group here at UCLA demonstrated that Tai Chi was effective in enhancing immunity to the shingles vaccine. So, and then as you know, some of you may also be aware, a little bit more mainstream as well as yoga. Yoga certainly both body exercise and mind exercise, and has been effective in addressing chronic and persistent pain. So, exercise is important. I just want to highlight that this is something we all should think about. We should all think about doing the right types of it, doing all the different types of it. You can see here in this comic, where many of the different activities might fall in the spectrum of type of exercise. For people with chronic pain, one thing to remember, although it's getting cooler now, so it may be more difficult, and certainly in the age of COVID, it's harder to get access to a swimming pool, but aquatic exercise, very good for painful conditions, low impact activity with decreased load on the bones, joints, and muscles. And you get an exercise that you don't get on land. There's a natural resistance that's offered by the water for strengthening. I would just comment on sleep. Make sure that there's a routine, that you set the stage for a successful night of rest, right? So make sure that the environment is quiet, that you use the bedroom only for sleep and for intimate activity. You go elsewhere for other activities. Make sure you are, not having heavy meals right before you eat or drinking too much. That might cause you to have to go to the bathroom, get up to go to the bathroom. There are certain things that we should probably try to limit or avoid, including alcohol, even though we think of it as something that would kind of mellow us out. It actually can have paradoxical effects and worsen sleep. So how much sleep? I think the National Sleep Foundation in general would suggest 7 to 9 hours for most healthy adults, perhaps a little less for older adults, 7 to 8 hours. But, there is again, growing evidence base for the adverse health consequences of fragmented and non-refreshing sleep. Just like some comments on food. I'm no expert in food, and there are other experts within the collaborative, I think, working in this area, but I would just comment as it relates to pain. If we think of excitotoxicity as some of the neurological, neurochemical pathways that may lead to genesis and perpetuation of chronic pain, we would see that the things up on the top, are going to promote that. So these are the kind of things we want to combat. So that's why sometimes we might suggest, magnesium supplementation, omega-3 fatty acids, those are your so-called fish oils. And then, thinking about not having some of these additives that potentially could also lead to excitotoxicity. So you can see some of the commonly used food ingredients that we may want to limit or minimize. And then, conversely, on the bottom, you have so-called Mediterranean plant-based diet that is going to be helpful, not just for pain, but for overall health and well-being as well. I would also suggest and highlight for those of you, try to increase your intake of fermented or probiotic foods. So many people are interested in taking probiotic supplements. I think even better than taking a supplement, again, is to focus on food, and you can increase your intake of probiotic foods like yogurt, sauerkraut, kimchi, miso, kombucha, pickles. We know that gut health is going to be important, no less for the management of chronic pain conditions. So finishing up here, here's some other common supplements that are used in painful conditions. Again, I think food as medicine is always preferred. Okay. Again, when we take pills, it's just like taking drugs. So again, we want to focus on person-centered approaches. We want to keep that bank account full. We want to do well for ourselves. Many of the things are actually in our control. Certain things we need government to set policy. We need society as a whole to kind of make priorities, so that we may or may not have control over, or we have less control over. But there are certainly many things that we can do for ourselves to help ourselves, and certainly for pain conditions. So just to wrap up, I would leave you with these take-home messages that addressing persistent pain often requires a team effort, and really do not underestimate your own ability to affect your discomfort. In medications, they can be helpful. You just need to use them rationally and appropriately. Again, think about your posture and ergonomics. Again, by all means, we like to optimize use of non-drug, non-pharmacological approaches. Some of the things that we do in Chinese medicine and other integrative health approaches, really exemplify that approach. And then exercise, okay? Make sure that you're striking balance between the different types of exercise. And then, do not, forget to optimize sleep, eat the right way, and again, manage your stress. And right now, I think all of us, whether we care to admit or not, are under extreme amount of stress with COVID, with social unrest. But we really need to think about how to keep ourselves and our loved ones healthy. I'm glad that I was able to share our perspective and our approach on this Wellness Wednesday. So happy to answer any questions. I have looks like I went over a little bit too long, but it looks like there's a couple minutes. Maybe I can address any concerns or questions. Okay, so I have one question.